Hey everyone, it's Wednesday, time for Wisdom Wednesday. I'm sorry I videoed a Wisdom Wednesday last week and forgot to post it on, I'd send it out as an email. It is posted in the on the YouTube channel. However, I will attach it to this week's email as well. Hope everybody's doing well. It's been a while since I reviewed a little bit about thyroid hormone, so I thought that I would do so that you kind of understand a little bit more about thyroid and how we here help folks optimize their thyroid. The fact that there are several different tests available and different ways of looking at thyroid, and certainly there is a couple of autoimmune conditions that are associated with the thyroid gland. So briefly we'll touch base on those. But most people, when they go see their doctor, when their labs are drawn, they will check just one test. It's called TSH, thyroid stimulating hormone. And there is certainly a bell curve of what is considered to be the reference range, generally somewhere between 0.4 and 4.4, give or take a little bit, depending on the lab. But that's a fairly wide range. And that hormone itself is just a pituitary hormone. It does not tell us anything about what is happening with thyroid hormone specifically, other than whether or not it's in the reference range. Most people would consider that you are normal and must have enough peripheral hormone if your TSH is within the reference range. But what we know about thyroid is that the pituitary gland will release this hormone called TSH, thyroid stimulating hormone. It stimulates the thyroid gland to make a hormone called T4. And T4 is basically a molecule with two tyrosine particles or molecules, which are amino acids. And to that are attached 4 iodine. So that is considered to be T4. And T4 is relatively inactive. It has to go inside your cells, and within the cells, one of those iodine is removed. But in order for all that to happen, you must have enough of certain minerals, zinc, selenium, and iron. And this enzyme that is called a deiodinase, which is just means that it removes one of the iodine, and you get T3. And T3 is active hormone. This is the hormone within the cell that really helps us with metabolism and all the cellular functions, in helping the mitochondria create energy and many other things, keeping our temperature control set, etc. So it's kind of important to check those levels. And unfortunately, when you go see your doctor, for the most part, not all, but most physicians are just checking a TSH. And when you have optimal levels of thyroid hormone, your TSH should be relatively low. And unfortunately, what can happen though in our world is that we live in a stressful world, and when we are exceedingly stressed and we have a lot of high cortisol and our epinephrine's running around, and we're still struggling with just anxiety and all these other things that can occur just with our exposure to things in the world and just our life stressors and our lifestyle, not getting enough sleep, etc. This can all affect thyroid hormone. And if all you're doing is checking a TSH, you really don't know what's happening at the cellular level. And knowing what's happening at the cellular level is quite important for helping people optimize that. And we are seeing more and more people coming in with quite a bit of fatigue. And we know that even if thyroid hormone levels, even these peripheral levels, the T4 and the T3 appear to be normal, but functionally, the cells are not able to, quote unquote, sort of hear that thyroid. It's not getting into the cell where it needs to be, and the receptors are not very receptive to the thyroid hormone. We know as we age, we actually need a little bit more thyroid just to kind of keep metabolism going. So it's really important to optimize these peripheral levels, and it's not just the peripheral levels, but it's the free amount of free hormone, the free T3 and the free T4, that which is not bound to protein. If it's bound to protein, it's not easily able to move in and out of the cells and do the work that we need. So when we check thyroid here, we check the TSH and we check the free T3 and the free T4. There is when we're really stressed, we know that T4 does not convert to T3. It converts to a hormone called reverse T3. Now, this is a little bit more expensive test to do, so we rarely do it, but in some instances, it's important to check that as well. But we know when people are really stressed and their thyroid and they're very fatigued, that they are probably converting that T4 to T3, to reverse T3, and not to the active form of the thyroid hormone. So we know that that's the case. And also in people who have autoimmune disorders such as Graves' disease or Hashimoto's disease, there are antibodies. And these antibodies can be quite high. And we want to try to lower those antibodies so it doesn't totally destroy the gland. Although the people who've had thyroid cancer, who've had abnormal issues with their thyroid gland may have had either surgical removal or radioactive destruction of the gland, and they rely only on the administration of what we call exogenous thyroid hormone. So the fact that you might have Hashimoto's, it may have impact on having this autoimmune disorder, but we can replace the thyroid hormone and try to suppress some of those antibodies as well. So just as a recap, understanding that when you are looking at thyroid hormone in particular, it's important to have an understanding of what is the real active form, how do we make that active form, and if we don't make enough, how do we replace it? And certainly there are combination forms of thyroid. You can get it compounded. There are desiccated porcine versions of thyroid, for instance, Armour thyroid or NP thyroid. And then, of course, there's synthetic versions. We know that a lot of people are just on Synthroid, but Synthroid is just T4. You must have the ability to convert that T4 to the active form of T3. And a lot of people really don't do that. So there is another pharmaceutical available in the form of liothyronine or Cytomel. And there's not much flexibility in dosing. There's just a 5 and a 25 microgram dosing on that. So it's kind of challenging just to use those doses. So oftentimes compounded thyroid can be quite beneficial. So just to let you know, I just wanted to review this a little bit, that people who are struggling with significant fatigue, hair loss, poor cognition, even people who are struggling with anxiety and depression, the studies have shown that adding thyroid hormone can be quite beneficial in addition to whatever medications they may be on. And so a lot of the psychiatrists know that thyroid can be exceedingly helpful in dealing with anxiety and depression. So it's a very valuable hormone, and even though it's considered a minor hormone, it's still quite powerful and can have great impact in our overall health and wellness. Hope that's given you some further insight or a nice review for you so that you can understand how and why we try to optimize thyroid hormone. You all have a great week, and we'll talk again next week.